Most of us think that we are healthy, not knowing that our sugar level is high and our body is showing signs. These are the top 7 common signs that you have a high sugar level. Number 7. You always feel tired and exhausted. Fatigue and extreme tiredness are symptoms of uncontrolled blood sugar. When the body can't process insulin properly or doesn't get enough insulin, the sugar stays in the blood instead of being taken up by cells and used for energy. Frequent urination can also lead to dehydration, which identifies as another factor in fatigue. Having type 2 diabetes can lead to low energy levels. Newly reports that people diagnosed with type 2 diabetes feel tired. This fatigue is the result of an insufficient amount of sugar being taken up by the cells from the blood. If you always feel tired in the morning despite getting a good night's sleep, it's a good idea to check your blood sugar when you wake up to see if your tiredness is blood sugar related. Also, some people want to wake up in the middle of the night to test their blood sugar to see if they are high or low overnight. Blood sugar levels can fluctuate overnight, and your doctor or diabetes specialist should be able to advise you if blood sugar levels are causing you problems. But before you find out the other signs of having high sugar levels, be sure to leave a like and subscribe to Fortify Health Flow for more health tips and natural remedies. Number 6. Noticeably blurry vision and frequent headaches. Your vision isn't as clear as it used to be, and things can look a little blurry. High blood sugar can cause fluid to enter the eye and cause the lens to swell. This changes the shape of the lens, resulting in poor focus and blurred vision. You may also struggle at work, have difficulty driving, or suffer from frequent headaches. Swelling of the lens of the eye, leading to blurring of vision. When blood sugar levels change rapidly from low to normal, the shape of the lens of the eye changes and vision becomes blurred. It can be blurry. Vision returns to normal when blood sugar levels stabilize. If you buy glasses, check your blood sugar before the test to get the most accurate prescription for glasses. Diabetic retinopathy is the leading cause of blindness in American adults and occurs when retinal vascular changes cause either leakage of blood vessels or abnormal growth of new blood vessels on the surface of the retina. It is important to have regular eye exams so your doctor can provide these treatments when needed. Number 5. You develop wounds that tend to heal more slowly than normal. Cuts, scrapes, bruises, and other wounds heal more slowly in the presence of uncontrolled blood sugar levels, according to the National Institute of Diabetes and Digestive and Kidney Diseases. Diabetes reduces blood flow, especially in the lower legs and feet. Healing may be delayed due to insufficient blood flow to this area. Even small wounds can easily become infected, leading to serious conditions and even amputation of the leg. When a foot ulcer develops, the discharge may ooze into sarcs and have an unpleasant odor. High blood sugar levels can slow wound healing. It can also interfere with wound healing. Monitor and control blood sugar levels. This is one of the most important things you can do to heal your wounds. Work closely with your doctor to help the wound heal as quickly as possible. It can also reduce potential complications. Number 4. Notice numbness or pain in hands and feet. Uncontrolled blood sugar levels can cause nerve damage, also known as diabetic neuropathy. What you may notice is tingling or numbness in your hands and feet. Some people experience pain in their hands and feet. Neuropathy is most common in people with diabetes for a long time, but it can also occur in people with poorly controlled diabetes. A common symptom of diabetic peripheral neuropathy is hearing loss. You may lose sensation in your feet when walking. In other cases, the hands and feet tingle or burn. Or you may feel like you're wearing socks or gloves when you're not wearing them. A sharp, electric current-like pain may appear suddenly. You may also experience cramping, like when you reach for something like silverware. In addition, diabetic peripheral neuropathy can result in the inadvertent dropping of objects held in the hand. Diabetic neuropathy affects multiple peripheral sensory and motor nerves that branch out from the spinal cord into the arms, hands, legs, and feet. Typically, the longest nerves, those that extend from the spine to the feet, are affected the most. Number 3. Develop blisters, dryness, or other skin changes. Small pieces of skin called skin tags can form in the creases of the skin, especially if you have diabetes and are trying to find ways to control your weight. Areas of dark, thick, tender skin called acanthosis may develop, and these may be signs of insulin resistance. Blisters, infections, dryness, itching, discoloration, and skin abnormalities can be warning signs of high blood sugar. The hard, thick, swollen-looking skin spreads and may appear on the forearms and upper arms. It can also occur on the upper back, shoulders, and neck. Thickenings of the skin may spread to the face, shoulders, and chest. Wherever it occurs, the thickened skin often has the texture of an orange peel. This skin problem usually occurs in people with diabetes or difficult-to-treat complications of diabetes. Number 2. Swollen or bleeding gums increase the risk of infection. When blood sugar levels are high due to diabetes, saliva contains a lot of sugar around the teeth and under the gums. This helps the growth of harmful bacteria and plaque. Plaque irritates the gums and can lead to gum disease, tooth decay, and tooth loss. Gum disease causes the gums to bleed, become red, and swell. Gum disease is a complication of diabetes. It can also make diabetes more difficult to control because the body's response to infection is to release more glucose into the bloodstream. The higher the content, the more it binds to the food in your mouth to form plaque, which becomes food for the bacteria that cause gum disease. If left untreated, it can progress to periodontal disease, which can cause your gums to pull away from your teeth. Get your blood sugar under control and see a dental professional to prevent damage to your gums and teeth. Number 1. Rapid heartbeat or palpitations. Foods high in processed sugars and carbohydrates can cause heart palpitations if you have low blood sugar or what we call hypoglycemia. This is why it's important to watch your carbohydrate and sugar intake when you're hypoglycemic. Heart palpitations feel like your heart races, pounds, flutters, or skips a beat. You may notice your heart rate when you have a palpitation, or you may feel your heart beating in your throat, neck, or chest. According to the National Institutes of Health, heart disease is a common ailment in the general population, but people with diabetes are at the greatest risk, 4 times higher than them. The American Heart Association estimates that at least 65% of people with diabetes die from heart disease or stroke. Those are all the common signs that you have a high sugar level. Have you experienced any of those symptoms? And what natural remedy are you taking? Let us know in the comment section. Thanks for watching. Check out our other videos, like and subscribe.